Hi, this is Tanisha from Reyada 106.3, and here today I am at Reyada Medical Center to talk about that one thing we women very smartly ignore, our reproductive health. And for that, today two gynecology experts have joined me, Dr. Vijyalakshmi and Dr. Lufna.
Hello.
Thank you.
Thank you so much for being here, and how are you guys feeling today?
Great.
Yeah, really great. Actually,
It's a nice feeling.
It's very nice.
Okay, so doctor, I'll start with you. Right now, our lifestyle has become so sedentary.
Yeah.
So, what do you think will be the main challenges we will be facing in next 5 to 10 years in women's health?
Yeah, in the next 5 to 10 years, the major challenge that we face with our patients first is mental health challenge. You know, like women are twice at risk than men for anxiety or depression. We have seen many women suffering from eating disorders, body image issues, and because of this societal expectation, people go inside, right? Yeah, they feel very low. So mental health challenge is one of the topmost priority. We as healthcare providers can make this kind of access to mental fitness service a little bit more easier for the patients. The second thing is hormonal imbalance, especially because of the current lifestyle. As you know, it's too sedentary. We enjoy watching all the shows, and the internet is there, yeah, with so many non-stop entertainments going around. So that has taken a toll, especially on women's health, and leading to a lot of hormonal issues like polycystic ovaries and endometriosis. So these are the major challenges in the next 5 to 10 years.
So, as we know that due to the lifestyle again, PCOD, PCOS, and fibroids, these have become very common right now.
Yes.
So, how do you usually diagnose and treat them?
See, actually, whether it's like gynecology or any other field of medicine, the approach towards the patient is the same. Okay, we usually try a stepwise approach, and also the step one, particularly or the foremost, is actually the history. That is what the patient comes to the doctor for. Okay, they have a sort of issues or sort of complaints. So, like we try to structure our consultation so that the patient is given ample and adequate time to discuss about their concerns. So, particularly when we refer to the gynecology with the particular importance to the menstrual history, reproductive history, and all. So, once actually we get a good history, the half of the diagnosis is actually done. Okay. The art of medicine is especially like it's live, where we can actually listen to the patient and interpret their symptoms. Okay, so after the proper history is taken, then we'll actually move on to the physical examination part. The hands are the most important diagnostic tool in case of medicine, definitely. Yeah. So like we'll try to have a thorough and systematic examination of the patient. So when we come to the gynecology, it is particularly important to have a pelvic examination. That includes the speculum examination and the vaginal examination. And after this two, like the history and also physical examination, definitely we will have a set of diagnosis, like differential diagnosis we call. And the next is actually to conclude it or to finalize it into a single diagnosis, for which and also to the support or to supplement our clinical evaluation, we will be definitely ordering some investigations, which can actually range from the blood test to imaging. Most commonly used is actually ultrasound. So with the help of all this, like from history and also examination and with the investigation, we'll be definitely able to reach a diagnosis. Okay, and the treatment will actually depend upon the condition and the stage of the disease. It can be just a medical treatment like medicines which can be taken by the patient, or maybe like in certain stages only surgery may be the definitive management for some conditions.
So usually all these things, like if you have diagnosed something specific, it affects their mental health also. How do you deal with that?
Definitely. Actually, patient actually will be coming to us with a simple complaint, but actually in the end, like after all these things, maybe like something which has a potential to change their comfort zone or change their life may be diagnosed. So definitely the mental health or the support to the mental health is very important. So I think actually we take adequate time to discuss, to create the rapport and to discuss the issues with the patient, and also will provide as much as support from our side that is possible, and definitely the family will also help actually.
That's a great approach. And as you were talking about the lifestyle doctor, so what will be the three main things or changes you would want women right now to add in their lifestyle, or they have to do this so that they do not get all these problems, or they can prevent them?
Yeah, time is running fast and yeah. So the first and foremost is maintaining a healthy weight through a balanced diet and regular physical activity. The second, I would say, manage stress and prioritize sleep. At least 7 to 8 hours of sound sleep is essential. A good sleep will essentially help in repair of the body cells. The body is really a magic. It can take care of itself. We just need to give it more time. And third, avoid as much as possible smoking, alcohol, the recreational drug.
That's great. And what do you think should be the approach, apart from these tips ma'am has given, what should be a woman's approach to prevent all these things, apart from changing their food habits or exercising, mentally also, like we try to fit in the circles. So what they need to change about that?
Yeah, I think actually we are definitely in an era where actually there is actually shift in medicine from a curative aspect to preventive aspect. That's also gaining utmost importance now. So like whether it is a gynecological or whether it is related to infertility or obstetrics, we are no longer actually reaching the situation where the complications or diseases has already occurred, so that the treatment will be difficult. Now actually we instead of this, we are actually screening for the risk factors now. That's more prevalent now, and that part of medicine is developing more now, so that we can actually step in and stop the high risk behavior, so that the development or to some extent the progression of the disease can be prevented. So as we know, prevention is always better than cure. That applies here also. So during the regular checkups, actually the preventive aspect of gynecology will vary depending upon the age and also the need of the patient. So it can be actually from the preconceptional level, where actually the patient comes for the preconceptional counseling. We can actually screen the patient for many medical disorders which has got an adverse effect on the pregnancy, and help to attain an optimal health, so that actually we'll get an optimal pregnancy outcome also. So, and also like screening for many cancers are available, especially when we come to the gynec cancers. Breast and cancer screening is very gaining importance nowadays. So many people are not aware of the screenings available. So with health educations and awareness classes, we are actually making it actually available, or awareness is actually created among the population, so that actually the diseases or the cancers can be actually screened and can be diagnosed at the earliest stage, sometimes even in the pre-cancerous stage, so that actually we can prevent the progression to the cancer. That's also very important. And also regarding the mental health, and we know that it is even though the technology is advanced that much, with regard to mental health, it has got that much of importance also, because the mental health is very worse now.
And it affects, and minute thing can affect it. So
Yeah, and people are very vulnerable also. Maybe especially our kids and all, no, they are very vulnerable. They cannot even actually stand out with a small stress. Not like our own childhood, where we were actually more stronger, I think. Actually, now because of the care we are giving for the kids, or priorities we are giving for them, maybe because of that they are very vulnerable, especially the puberty age group girls. Actually, they cannot actually stand out in mid of the stress. So this actually mental health is also very important when we refer to the preventive. Maybe an open talk, or maybe an open conversation can actually help them to overcome the stress and all. This is very important nowadays actually.
Great points. And actually I think the people who are listening or watching right now must have a lot more questions, and it is such a vast area that we cannot cover everything in one go. So you guys know where you should be coming when you have questions regarding women's health, reproductive health. It's Reyada Medical Center. We have the experts here, Dr. Vijyalakshmi and Dr. Lufna. Thank you so much for giving us your time.
Thank you. It was a good time.
Thank you.